Hey there, my name is Robert Stevens. I'm presenting at HealthNet, and I'd like to thank Lori Coppinger and Sally Hansen for allowing me the time and the space at their company to do my presentation on healthcare-associated infections. So healthcare-associated infections, also known as HAIs, I'll be referring to them as both. It's when a degree of sterile carelessness occurs, and that's basically when like a healthcare provider or a patient doesn't wash their hands, or something else like touch something that they're not supposed to during the healthcare process. And like what Hippocrates says, I will use my treatments for the benefit of the ill in accordance with my ability and my judgment. But from what is to their harm and the injustice, I will keep them. So basically that's just keeping the people and patients from harm during the healthcare process, which is extremely important. And yeah, I'll progress through the slides here. All right, so there's 4 different types of primary healthcare associated infections that patients most commonly run into during their stay at a hospital or healthcare facility. First off, there's one that's called the CLASB, which is central line associated bloodstream infection. And usually that occurs when a central line gets inserted into the patient, and it's also referred to as a PICC line. And that's when there's a catheter that goes into one of their blood vessels and typically into the heart. And usually what happens when you get a CLASB is there's red skin, and then there's other issues that occur around the dressing at that site. And then there's the other really common one, the catheter-associated urinary tract infections. And there's a lot of moving parts there. So it affects the bladder, ureters, and the kidneys. And it's the most common one. And what happens with these ones is if it doesn't go in sterile, it can cause an infection, or a patient can tug and pull on the catheter, and then that can cause issues as well. And then there's surgical site infections, and this is a very common type of healthcare associated infection. Usually what happens with these is a patient went in for a procedure, some type of minor procedure or surgery, where they had to incise into the patient, and the patient's experiencing symptoms of like pus and bodily fluids and redness and swelling, and there's usually a fever associated because the body's trying to combat the infection, and that's pretty common, especially after surgeries. Then also the other most common type of healthcare associated infection is the ventilator-associated pneumonia, which is VAP, which is something that's kind of concerning, especially now with COVID, with a lot of people getting intubated, and depending on the sterile process that a facility may use for their intubation devices. And it's also really common for other patients that just use oxygen in general, because if their tubing isn't sterilized, they can get a healthcare associated infection from that, and it's typically some sort of pneumonia due to using the oxygen. Right, and then patients that are most susceptible for obtaining healthcare associated infections are usually 65 years and older, so geriatric patients, or patients that come into the emergency department that are experiencing sepsis or acute renal failure, or have utilized a high amount of antibiotics in the past. And like in the prior statements, using a catheter, or have had a recent surgery, or using oxygen for help for breathing. And then patients that receive HAIs or healthcare associated infections while at the hospital, they are at far higher risk of getting readmitted into the hospital. And and this was seen greatly in 2004 off of Medicare's website. They stated that in 2004, 20% of their beneficiaries were readmitted into the hospital within a month due to their prior hospitalization and obtaining a healthcare associated infection, and that costs Medicare alone over $17 billion. And then caregivers are a crucial part of healthcare associated infections. One of the most important parts, obviously, is just hand hygiene. According to the World Health Organization, there are 5 moments when it's critical for the healthcare worker to partake. And it's hand hygiene before touching the patient, before a procedure, especially aseptic procedures where you want the patient to be sterile and your hands to be sterile while working with the patient. When there's bodily fluids, and then after touching the patient as well. It's also imperative for caregivers to use the standard precautions for a sterile glove cleaning prior to touching the patient and after touching the patient. 'Cause a lot of times people just don't realize that gloves are a one-touch use only. And then also like working around patients that are on ventilators, you want to wear N95 masks to prevent not only catching anything that the patient may have, but also to prevent giving the patients some sort of infection during their stay. And there's also abundance of other like protective gear you can use, such as headgear and shoe coverings. And then there are 2 really important procedures for preventing healthcare associated infections during the patient's hospital stay. So there's hourly rounding and care bundling. That's where caregivers come into the patient's room once every hour just to ensure that the patient's needs are being met. And this is also kind of like preventive maintenance prior to the patient utilizing a call light to ensure that they get their needs met and they get toileted in bathrooms. And also the no pass zones, that's addressing the patient's needs immediately when they hit the call button. So regardless of the title of the caregiver, whether it be a nurse's assistant, medical assistant, nurse, doctor, when that patient's call light goes off, that practitioner goes in there and then they address the patient's needs immediately. And while addressing the patient's needs in the no pass zone, then they also address the care bundle to ensure that the patient's needs are being met. That way the care is safe, and also it prevents healthcare associated infections. All right, and then before we get into our discussion, I'm going to pull up a video regarding healthcare associated infections. And it's just like a kind of like a little overview of what I just stated.
Healthcare-associated infections, or HAIs, are infections you may get in a healthcare facility while you are receiving treatment for a different condition. Bacteria such as methicillin-resistant Staphylococcus aureus, also known as MRSA, Enterococcus species, and Clostridium difficile, or C. diff, are frequently the cause of healthcare-associated infections. These infections are a major cause of death around the world. One of the most common ways these bacteria get passed from person to person is through lack of proper hand hygiene. When people don't clean their hands, they can transfer microbes from one patient to another, or from one part of the body to another on the same patient. There are 4 common types of healthcare-associated infections. A surgical wound infection can result when bacteria get into your incision and spread through your tissues, leading to infection. A urinary tract infection can occur when you have a catheter in your bladder, which is a tube used to drain your urine. Bacteria can enter your urinary system on the catheter, enabling the bacteria to travel into your bladder where they can grow. A bloodstream infection can occur when you have a central line in your vein, which is a slender tube used to deliver fluids or medications into a large vein near your heart. Bacteria can enter the skin around the insertion site or directly into your bloodstream, where they can cause infection. Pneumonia can result when you are on a ventilator or breathing machine. Bacteria can enter your throat while you are being placed on the ventilator. Then you may inhale the bacteria into your lungs, leading to infection that can cause pneumonia. Hand hygiene, a simple, low-cost, and effective procedure, is the single most important method of preventing healthcare-associated infections. All people in healthcare facilities, including patients, visitors, and medical personnel, can help prevent these infections by cleaning their hands frequently. Hand hygiene can be performed with soap and running water for 40 to 60 seconds, or by thoroughly rubbing on an alcohol-based hand sanitizer for 20 to 30 seconds. If you are receiving healthcare, you are part of the healthcare team, and you should make sure that everyone who comes into contact with you cleans their hands.
And now it's time for the discussion portion of the presentation. So according to a study of law in California, they imposed a limit of the number of patients that a nurse can take, and it did show that there was a great reduction number of healthcare associated infections that patients were getting, as well as improvement of likelihood of a patient surviving their time during care at a hospital. And also a lot of nurses found that work was easier, and also there was a 34% decrease in unlicensed practitioners on the job at the hospitals. So with that said, we're going to have a discussion about staffing policies as well as no pass zones. So over here we have Sally. She's a nurse case manager, and she works with HealthNet. So just what you've seen, what are some instances where you've seen that care bundling and no pass zones have helped influence the level of patient quality for you?
So from the insurance perspective, what we're seeing is patients are being discharged with excellent discharge instructions, so they know exactly, like if they have to self-catheterize themselves, they know exactly what is needed and the protocols for that as far as sterile procedure goes. And those that are discharged with indwelling Foley catheters, they are known to have a caregiver at home that can assist them with the sterile procedures to minimize any infection rates that might go along with that. And the education piece with that is crucial because the more you catheterize, the more you're introducing bacterium into the bladder, and so these patients are very aware that they need to be practicing sterile and clean procedures in the home and in the facility, and the nurse is responsible to educate the care staff that's involved with this patient to make sure that is accomplished.
Perfect. Thank you so much for that. So in conclusion, healthcare associated infections, there's a variety of different factors that influence them, such as public health policies, such as nurse staffing, as well as policies implemented by the facility itself, such as no pass zones and care bundling that the nursing staff should be performing, as well as other issues such as nurses, patients doing their hand hygiene throughout the care process. Like was said in the video before, even the patient as part of the care team. And with that being said, all healthcare-associated infections are caused by a degree of sterile carelessness that has occurred during the care process. And I'd just like to thank everybody that's come here tonight for the presentation.